Good afternoon, everyone. First of all, I'd like to say a thank you. When I spoke last week, I asked you to stay inside once again, and you did. I asked you to continue to social distance, and you did. I asked you to only shop infrequently for necessary supplies, and you did. Once again, we have shown our strength as a community. I would also like to thank the Isle of Man sports stars for contributing to the social media video that we published on Saturday. Now turning to today's latest case and testing figures. To start, I regret to have to announce that I have just been informed of 3 further deaths in the community setting, which now brings our total number of deaths to 9. We have lost 3 more to this dreadful virus, and I can barely begin to imagine the heartache their families and loved ones are experiencing at this time, and my condolences go out to them all. The total number of tests undertaken to date now stands at 2,509, of which we have had 2,417 back, leaving 92 outstanding. The total number of confirmed cases stands at 300, with 200 presumed recovered, leaving 91 active cases. The total of new positive cases so far today stands at 1. I'm being joined today by one of our senior nurses at Nobles, Matron Liz Howard, and I'll be inviting Liz to say a few words shortly. 2020 was designated as the Year of the Nurse and Midwife by the World Health Organization in honour of the 200th birth of Florence Nightingale. And although when we launched it, we were not aware of the global pandemic that would change our lives, nurses have shown why they deserved this international recognition. It is certainly proving to be a year our nurses will never forget, not as we would have wished it, and not quite as planned. They have been challenged as never before, and are giving their utmost. Recognition of the crucial role nurses play in our society is, among so much detriment and despite the circumstances, truly a positive and welcome gain. Our third-year students are finishing their training with hands-on nursing and have been helping at our coronavirus testing centre at the grandstand. At short notice, nursing and care staff have provided support at one of our residential homes, and they continue to be very flexible, provide support and care where they're most needed. I've previously said that we will be doing our own testing for coronavirus from today. I'm pleased to say that on-island testing commenced earlier today as planned. Having capability to test samples on island is great news, and it gives us capacity to run tests as and when we require, and to gain results within a shorter time frame than has been the case until now. I know there's a lot of interest in the on-island testing, so I'd like to offer some further insight into how this came about. The equipment coming online today is a real-time PCR analyser of exactly the same standard as used by Public Health England. We have a picture, I believe, from the microbiology team that we can show. This sort of equipment would normally never be found in a general hospital, but the journey to this point has been quite eventful. It began in early March when molecular scientist Dr. Rachel Glover from Taxa Genomics reached out to ask if we could collaborate on a local solution. Working with our own senior scientist, Chris Helm, they identified a piece of kit at the Public Analyst's lab that hadn't been used for a few years but was perfect for our needs. They installed it in Nobles and have been working 7 days weeks to recommission it and work up an in-house method. There have been challenges along the way, including essential parts needed, remember the helicopter delivery, plus finding a way to automate the process and the sourcing of reagents. For the last 2 weeks, they've been running samples in parallel with PE Manchester and have now validated our method. The first run of samples went in this morning at 8:30 into its 6-hour process. Another run will be started later this afternoon. It can turn results around within 24 hours compared to the 48 to 72 hours we are currently experiencing at the moment. To be able to test for coronavirus on the island has been our long-term plan since we started our battle against this dreadful disease. It marks a step change from this point forward in how we will be fighting back against COVID-19 in the future. Our ambitions around testing come from our approach to slowing the spread of the virus in our community. Our premise has always been to test, trace, inform. The virus spreads from person to person, and while someone may not have the symptoms, they could inadvertently be spreading COVID-19 completely unintentionally. With robust testing and contact tracing, we can and have advised people to self-isolate more quickly and thereby slowing the spread in our community. Our ability to do this on Ireland will now revolutionise the way we operate and makes us masters of our testing destiny. As I said, we expect the results to be turned around in 24 hours and using text messaging to be able to inform people of their results in real time. Thank you again for your work as an island, as a community, to slow the spread of the virus, to flatten that curve that I keep referring to, and protect our health and social care service from being overwhelmed. And at this point, I would like to bring in Liz.
Thank you for inviting me here today. And although the Year of the Nurse and Midwife has not been the celebration we'd planned, it has become a year that demonstrates the incredible work that nurses and midwives continue to offer the Isle of Man community. I would also like to extend my thank you to the Isle of Man community. An incredibly challenging time for all of us working in healthcare, and the community here has shown us so much solidarity. I would also like to share with you that nurses and midwives sign up to what we call the 6 C's of nursing. These are care, courage, commitment, compassion, communication and competence. Every day, my colleague Emma and I see the care and compassion that our nursing colleagues have not only for their patients, but for each other and their professional colleagues. Every day, we see the commitment and courage of our colleagues to do extra shifts and work in areas that are new to them, which is unprecedented in the world that is now COVID-19. Finding new ways to communicate with families and loved ones has been inspiring, and finding new ways to communicate with each other and our professional colleagues continues to be developed and changes daily. On behalf of Kath Quilliam, our Director of Nursing, I would like to thank everyone for working together to keep our patients, our community and each other safe. We must continue our fight back against COVID-19. Together with our public health colleagues, we are consistently working to help stop the spread of the virus. The best way we can do this is to regularly wash our hands for 20 seconds using soap and water, and especially so after we blow our nose, cough or sneeze into a tissue and before we eat or handle food. We need to maintain our social distancing and not forget why we're doing this. COVID-19 does not discriminate by gender. It does not discriminate by age. We can help stop the spread of this virus, but only by keeping our social distance and following our proper hygiene precautions. Please stay safe, and thank you.
Thank you very much, Liz, for that. And please pass on my thanks to all of your colleagues across the nursing sector for everything they're doing. The amount of effort that has been put in to battle this dreadful disease has been truly phenomenal. So thank you to each and every one of you. I believe we do have today's graph, which we can show you. I've just been informed, which you should be seeing on your screens now. Okay, I will move on to questions from the press, and I start off with Josh from ITV.
Thank you, Minister. Obviously, our thoughts are with the family of those who have died. Are you able to offer any more information on this, and can you confirm if they were in Abbotswood nursing home?
I can confirm that all 3 were from Abbotswood. As I've said, Josh, and I explained at a previous press briefing, the issue with community deaths is there's a lead-in time before we can report them, because when someone dies in a hospital setting, we know why they've been admitted, and we've got that data, so hospital deaths are reported quite quickly. With community, we have to go through a process with the coroner of establishing death, but yes, tragically, all 3, I believe, are from Abbotswood.
Okay, so based on that, what reassurance can the government give people that their takeover of the home is having an effect?
Well, again, Josh, we've gone in. We are coping with what's happening there in the home. We are assisting the home. I need to make that absolutely clear again, because again, you've used the word takeover. We have stepped in to assist. The home itself is still although the licence is suspended, they are still the licensee. They still own the business. They are still effectively the operator. We have stepped in to assist in terms of guidance. Unfortunately, with this dreadful disease, we know what effect it has by age profile. I brought up the graph at the last press conference, and we know what the impact is on those more elderly and vulnerable in our community. And this is exactly what we've seen in relation to this, sadly, in those 3 cases.
Okay, my second question, what health factors will you be looking into to determine whether someone is eligible to go back to work, and will someone who is presumed recovered from the virus be eligible to return?
So in terms of people returning to work, the sectors, first of all, on whether people can go back will be done, as I've said previously, on a medically assessed basis. So the factors we would look at is, can social distancing be maintained? If social distancing can't be maintained, what are the risks around that? What protective equipment, if any, is required for that sector? How much wide interaction do they have with the wider public? So are they operating in an isolated environment, or are they, say, dealing with 100 people on a daily basis? Those are all risk factors that will build up a picture medically that will decide what industries, or even what parts of industries, can actually come back. In terms of people presumed recovered, obviously if they've had the symptoms, they've got over it, and they've had a positive diagnosis, then there is nothing to stop them, once they've completed their 14 days, returning to work. But in terms of activating sectors, that won't be something that would come into it, whether we've got a large amount of presumed recovered. It is purely the risk basis of that sector operating and what impact it would have.
Thank you.
Next up, I have Chris at Energy.
Good afternoon, Minister. First of all, our condolences to the families of the 3 victims today. It is a tough time for many people at the moment, but it's a particularly difficult time for those who are struggling with existing health problems, who may need to go off island to receive treatment. Could you confirm if said patients have to spend a 2-week period at the Comis Hotel upon return to the island or not?
No, they don't, and there's a very simple reason for that, which is there's medical protocols around patient transfer. So our patient transfer has reduced right down, is what I should say first of all. It is only those now it's basically life-saving treatment that are travelling over. As you will know from previous press conferences, even a lot of cancer care has been suspended because the UK has suspended most of its cancer care. So the process that happens with patient transfer is they fly out via plane into Liverpool Airport. They are collected there, taken direct to the hospital. Then they receive their treatment. They are then transferred direct back to the airport, back onto the plane and into the island. From there, they can self-isolate at home. Now, the reason that there's a difference with them being allowed to self-isolate at home is their risk profile is different. They haven't been travelling out into a community. They haven't had experience of multiple different people in the same way as, say, someone who's been wandering around Liverpool or Manchester. So the risk profile from the clinician's point of view is that they are less of a risk in terms of self-isolating at home. But also, being blunt, a lot of the people we're sending via patient transfer, they're not just self-isolating at home for 14 days. These are people in the vulnerable category who are basically self-isolating permanently, because, being quite frank, if those individuals catch COVID-19, it could actually prove fatal to them.
I do understand that, but given the UK is one of the worst affected countries in Europe by the coronavirus, and that many frontline healthcare staff, as we have seen, are testing positive for COVID-19, is the Manx government not undermining its own policy by allowing the residents who have been off island to return straight home?
Well, no, because it's done on a risk profile basis, as I said. So if you look at someone who's travelled throughout the UK, say they've landed at Gatwick, they've then got on a train, they've used services the whole way up in the UK, that's a different risk profile to someone who has purely gone into a clinical hospital setting. So, for instance, services in the UK are risk managed around health. So, for instance, any service where there is an outbreak of COVID-19, that area of the hospital is shut down, it is deep cleaned, etc. So there is more containment in that sense. If you've got someone wandering around UK communities, say in London, they've got more chance of contracting the virus. So it's about risk profiles. And as I say, these individuals, they're not just in isolation for 14 days. Most of the ones I know of, they're in permanent self-isolation, because if they do contract COVID-19, it could prove absolutely fatal to them due to their vulnerabilities.
Thank you. And as we continue to increase our capacity for testing here on the Isle of Man, is there a possibility that those who do return from off island, if they are tested after a couple of days to show that they do not have symptoms, they do not have the virus, that they are allowed back to their own homes?
Well,
it could potentially
Chris,
be more dangerous
I think
for them if they
Henrietta
stay
covered
with
this
those
off
who
at a
have
couple of
tested
press
positive.
conferences ago when the Director of Public Health came along. What we've got to remember is there's always false negatives as well with any form of testing. And as Henrietta explained around the swab testing, it checks for viral load. If people are early in their symptoms, there is the risk that it won't actually show up. So that is why even people on Ireland who are told to self-isolate at home, even if their test comes back negative, they still have to complete the 14-day isolation. So that wouldn't change. So in terms of returning travellers, and I've said this time after time, it's a heartbreaking decision that had to be made in terms of quarantine. I hope that none of my successors in years to come as Minister to Health have ever had to be involved in decisions like that. But it is absolutely clear that if we end up with a second bounce effect of viral load in the community, that could be devastating for the community at large. All decisions are kept constantly under review, and repatriation will be no different. And over time, we may be able to relax that. But the firm view, the absolutely unanimous view of our clinical leadership team is that quarantine is the right approach, and that still remains the view today.
Thank you very much for clarification on that.
OK, I move on to Alex at the BBC.
Hello, Minister. Hi. You'll obviously be aware that people on the Isle of Man who've been classed within the vulnerable categories have received a 2-page letter from the DHSC in recent days. I'm just wondering who collates and manages this list of vulnerable people, and how are these people's conditions being flagged to healthcare professionals?
Well, we actually have digitised records now. One of the things that was being developed before I became minister and then was completed when I took over. So we have a much more integrated system. There's adult social care as well that obviously maintains a list of who they are in contact with that is vulnerable in the community. So it's multidisciplinary. It's across DHSC. One of the things I've said continuously since I became minister is that in DHSC we are moving away from operating in silo mentalities. So it is every single part of DHSC, from adult social care to those who deal with the more vulnerable in society, coming together to compile that list. GPs as well have been involved in that process. So we've had primary care involved. So it's a multitude of disciplines that have come together to be able to build it.
Thank you. Just to move on to the very unfortunate and sad situation down in Ballasalla at the nursing home there. Can you confirm how many DHSC staff are currently on the premises and how many Abbotswood employed staff are currently on the premises working?
I don't have those figures with me as to what the mix of staff is, but the key important thing is they're working together as a team. That's the whole purpose of this. We are there to assist the home. I need to emphasise again, this hasn't been DHSC come in and just take it over. The licensee is still the licensee, even although the licence is suspended, and they are still basically own the premise. We are providing health and support, and that's how it's maintained.
Thank you.
OK, next up I've got Jess from Isle of Man Newspapers. Hi,
Hello,
Jess.
Health Minister. Hi. So other than increasing the speed of test results at the on-island testing centre, what tangible differences will the online testing centre make on here in the island battling coronavirus?
The big one will be capacity, because we'll be able now to process up to 200 tests a day. So what we can look at is we can look at doing, as we see our community testing slowing down, which again, as I've pointed out over the last couple of press briefings I've done, that's what we've seen. We've seen a drop off in the calls coming through 111 and referrals in. What we can do is start looking at more proactive testing, so we can look at things like key worker testing, we can look at wider testing in nursing homes for those in a more vulnerable setting, and then longer term we can look at reprofiling how we do our community testing. So that's the benefit of it. But also the other big benefit is the turnaround in time, where you said other than, but that's very crucial, because if we're turning tests around in 24 hours and we're getting the results back, that means we can do the contact tracing earlier. So it limits the amount of people that someone who's been positive might actually have come into contact with, and their contacts might have come into contact with. So by getting those test results early, it allows us to really push on the contact tracing and breaking the chain of the virus, which is the whole point of the testing.
Okay. And looking at the other side, so on-island testing has been set up pretty quickly. I'm just wondering, what kind of challenges does the laboratory expect to face as this goes ahead in terms of staffing, equipment, and more so?
Well, the challenges have been ironed out. The problem has been the process of getting everything together. As I referred to in the speech, logistically, getting the equipment over to the island, getting it set up, they've been the real challenges. The staffing-wise is going to be done by our existing microbiology team. They have worked exceptionally hard to make sure we can have this up and running, and I really can't thank them enough. But logistically, I can't praise microbiology enough, because it's and DOI and everyone involved, because it is a bit of a nightmare logistically moving this kind of equipment around. I referred in my speech to the fact that we had the private helicopter help us with getting items in, because it was stuck in certain parts of the UK. So that's been the real challenge. The challenge has been the process of actually getting this up and running. And again, a huge heartfelt thank you to everyone who's been involved in any way in that.
So you're not expecting to make tweaks or alterations as this goes along?
No, it's been well tested. The reason is, when you do anything like this, you've got to actually make sure that what the results you're getting back are accurate, because that's the most important thing. So we have been running, as I think I might have referred to, or maybe Catherine did when we did the briefing together, that we basically, over a period of time, have been running the equipment we've got alongside Manchester. So we have been sending tests to Manchester to processing, and we've been processing the same sample here to cross-reference and make sure that the result we get back from Manchester is the same as the result we get on Ireland. So there's been quality testing going on for quite a period of time. But what this will allow us to do is it will allow us to look at how we deliver that community testing in the best and most efficient way possible for the island.
Okay, thank you.
Next up, I've got Amanda from Jeff the Mongoose. Amanda.
If the Loganair bailout deal with the UK government is not worked out, what is the island's contingency plan for crucial UK patient transfers?
Well, in terms of patient transfer, I mean, Groundhog Day, we've been here before. Loganair says that they are committed to the service, to continuing to run it. Obviously, for the aircraft industry, it's a very delicate time. I noticed on the news this morning that Richard Branson was saying, even in relation to Virgin Air, that he would be looking for some kind of government support, because otherwise they could be in trouble. Everything's changing day by day. We will have to deal with problems as they come along. But in terms of our patient transfer currently, it has been very, very much reduced. As you know, we had contingencies when we had the Flybe issue. Those contingencies are still there. We can, if necessary, use the boat with appropriate social distancing, or cabins on the boat, in order to allow people to be isolated accordingly. Those plans are still in place, but obviously a number of patient transfers has drastically reduced, because we are only sending those now where it is effectively life-saving treatment that they require.
Thank you very much, Minister. And for our second question, we have another transport one. If the virus spread in the UK is deemed too much of a risk to open the Manx borders in the coming weeks and months, would the government consider direct flights to European countries thought to be safer in a bid to maintain our links with Europe?
Well, it depends which European countries you deem safer, because the situation is evolving in Europe as well. You're seeing peaks and troughs across all the countries of Europe. Austria, for instance, that has seen initially a pretty good response to the virus, they've been having spikes. What's important as well is we've got to remember that just because you're coming in from a flight, say from France or from Spain, it doesn't mean you've not been somewhere else prior to that. It's about ensuring we don't end up with the viral load increasing in the community. So to be perfectly frank, in terms of borders, I would say we have a long way from that yet. We've got to have confidence in the data, and we've got to have confidence in the wider picture outside of the island. You know, while we can do things like border controls to protect us inside the island, we've got to be aware of what's going on around us. And I would say certainly with what's going on at the moment in Europe and in the UK, we are going to be quite a way off that.
Thank you very much.
OK, next up I've got Alex from Manx Radio.
Good afternoon. We're hearing a lot of concern regarding Ramsey Cottage Hospital that the isolated dialysis wing is now effectively alongside the relocation of the minor injuries unit from Nobles. Can you give us your reaction and any assurances over the close proximity of these two areas, especially with those on dialysis with immune system issues?
Yeah, so clinical space is divided off. It's in terms of clinical, it's not necessarily what is next to each other, it's the processes you have around how that space operates, so who people are coming into contact with when using that space. My understanding is there's very strict protocols up there around that, particularly around those immune at risk individuals, so that they don't end up sitting in the same waiting area. But equally, anyone presenting symptoms of COVID-19 should be ringing 111. They shouldn't be presenting at a hospital anyway. And the COVID wards are at Nobles, which of course is a much bigger space to be able to take that. But in terms of I believe there's actual set protocols in place to ensure that clinical space remains isolated from the rest.
So does that mean there's nobody with COVID-19 being treated at Ramsey?
As far as I'm aware, no.
My other question, if there is another outbreak in a care home like we're seeing at Abbotswood, does the department have the capacity to continue to potentially step in the same way?
Would hope not to have to step in, and that is something we don't just do. We try to work with the home. In this particular home's case, there's been certain reasons we've had to give them enhanced support, that they've been struggling, but we wouldn't expect to do that with every care home. There's processes and procedures in place to allow people with COVID-19 to be able to be self-isolated within the home, staff and the equipment that they use, including housekeeping services as well, to ensure that there's a separation and that you don't end up with cross-contaminant infection. The issue with Abbotswood is it spread quite quickly through the home, and we've had to step in to assist.
Are you planning contingencies, though, if there are other similar situations in private care homes?
Well, it depends upon the situation, because every situation is unique. So some of the homes, for instance, are very easy to divide off into wings. So one of the things you would expect an operator to do in those circumstances is, if where they were starting to see widespread transmission, is allocate one part of the home for those who are self-isolating, one that's what you would term a clean area, where there's been a deep clean for those who aren't. Some care homes are smaller. We have a multitude of care homes across the island, some very small units, some very large units. So the contingency would really depend upon the care home individually, because every care home is unique, and also the profile of the residents they have is unique as well.
Thank you.
OK, next up I've got Leanne from 3FM.
Hello, Minister. Hope you're well.
I am.
My first question, with the confirmation that the online testing facility is now up and running and the turnaround time for test results will now be around 24 hours, is the government's aim still to provide 2 daily coronavirus updates, or is this subject to change?
I believe the process at the moment is we will still be providing the 2 updates, so we'll still be doing the 10 a.m. and the 4 p.m.
Okay. And my second question, I've read that some police officers in the UK are unable to fine those under 18 if they're breaching self-isolation or social distancing guidelines. What powers do police have on Ireland if they come across youngsters doing the same?
Well, if people are under the age limit, then obviously they're the responsibility of their parents. As the Chief Constable said when he did a press conference with me, the police would seek to hold the parents accountable if young people are not abiding by the rules. So ultimately it's a parental responsibility matter. And as was made absolutely clear by Chief Constable Roberts when he was here, the police will actually take action if necessary against the parents.
Thank you.
Okay, and then last but not least, he's waited patiently for me. It's Paul, MTTV.
Thank you, Minister. I need to walk you back on what you were saying earlier about this machine now that, you know, if someone's coming back on the boat, they can't just have a test because you said it might not be accurate. So the question, I suppose, is how accurate is your machine? You know, will it give false positives and all that sort of thing? So in other words, the second test may be required.
First of all, I need to clarify, I didn't say it wasn't accurate. I said, as with any form of testing, there is always false positives, false negatives. No testing is ever 100%. But we know particularly from testing around the world that if people are asymptomatic, so they're not showing symptoms, and it's early in the 14-day incubation period of this virus, then the viral load might not necessarily be picked up by testing. So say you've literally contracted it that day, the viral load has still got to build in your system. So if you were tested on day 14 of your incubation, or day 1 if you want to reverse the numbers, of your incubation period, the test might not necessarily pick that up, but it would, say, 7 days later. So we've got to be very careful about thinking testing is the great panacea. The actual test that would be more effective, if there was one that actually worked, which I think I've referred to before, is antibody testing. But unfortunately, as we know, the antibody testing that is available for this virus, through trials, on average, it was about 30% accurate. So that just is not an acceptable level.
The incubation period has to be 14 days. It seems like by 7 days, wouldn't something be known and you could have a second test and then they could go out?
Quite possibly. We know the virus can incubate up to 14 days. We know that. Most people show symptoms between 5 and 7 days after contracting the virus, but not everyone. And, you know, so it's absolutely essential we stick rigidly to the protocols. The numbers we've come up with haven't just been drawn out of a hat, Paul. I can promise you they have been well and truly debated by our medical clinical leadership team, and we have played it very safe. So, for instance, the UK has the 7-day rule. After people show symptoms where they self-isolate for 7 days, but we know that people can actually still be infectious past that, which is why here on the island we've stuck to the 14. In fact, a case in point in the UK was the Prime Minister, Boris Johnson, who actually only really started deteriorating, I think it was on day 10, after him actually contracting the virus.
Thank you. This one has come in from someone who got in contact with me. Maybe the Matron would like to have a go at this one. I haven't had a question yet for her. And this is up at the hospital, and particularly in the COVID area. Apparently paper masks are there for the nurses, but they're being changed every 20 minutes. They've got plastic pinny, short sleeves, and this person has got experience or has somebody who's in the business in the UK who says that's probably not really enough, you know, in that sort of environment, not to use just a paper mask and short sleeve. They should have the full personal protection.
Right, before I bring Liz in, just let me say that there's guidelines around what PPE is used in what circumstances. So, you know, you would expect that there's, you know, you will see people wearing different things in different settings. So it depends upon the role that individual is undertaking at any one time. In some cases, things like a paper mask and a pinny would be appropriate. In other settings, they wouldn't. So there's a very regimented clinical guideline process around what equipment is used when. So without knowing the exact role that person was undertaking at the time, I can't really comment further on that. But I'll bring Liz in anyway.
Thank you, Minister. Yes, I would agree. We have protocols for depending on what your contact point is with your patients. So for people going into the COVID areas who aren't contacting any patients, or they're not in any close proximity within 2 metres of those patients, you only need a mask. And whereas nurses and those who are going into contact with their patients have full PPE in situ. So everybody is safe and they're well trained. They all know what they can wear, when they can wear it. So there's no risk there. You know, we're just following Public Health England guidelines. So that's.
Have you got enough equipment, Matron?
Yes, we have. We have got lots of equipment, and we've been very lucky that we keep getting more and more coming through. So our teams have been excellent in providing equipment for us.
Thank you. Oh, and Minister, did you say what's the sort of false positives and that sort of thing? Did you have a sort of number that it is the industry standard for having a false positive? Didn't get answer on that one.
I believe that with the test, and I think again Catherine touched on this when I did the press conference with her, or I did anyway, that the actual standard is between 90 to 95% accuracy. But again, as I say, you've got to put that against. It depends at which point in the cycle you're testing someone. So if you're testing someone who literally has just contracted the virus and they're in the early days of that 14-day incubation period, it's less likely to be accurate than someone who's being tested on day 12 or 13. And the unfortunate thing with this virus, of course, is, you know, there's no sign anyone gets that says, oh, actually, I'm in day 12 or day 10 of the incubation period. I'll bring in Amanda, who's got another question.
Yes, I have a question for Dr. Howard, if that's all right. How are non-coronavirus related wards coping at the moment? Are you seeing a reduced patient footfall or staff absences, and how is morale?
Hi, morale is very, very good, I have to say. Because we've changed all the ward areas around, some of the areas that would have been, say, just looking after medicine are also looking after surgical patients as well. So it's a bit tricky in that respect to think about footfall, because actually what we're doing is combining areas together. So they're relatively busy. I have to say the staff in there are absolutely amazing. Everybody's supporting each other. Everybody's working really well together. And as I said before about the care and the courage and the commitment and compassion, it's amazing to see what people are doing in there. And that's not just nurses and midwives or anybody, that's everybody. So it's fantastic. So there are a number of patients in those sides, but the staff are coping very well, and they've been moved to different departments, working in different ward areas that they're not used to, and they're working admirably to do that.
Thank you. And sorry, just one further thing. Are there any, or are there many staff absences?
There are a number of staff absences, but not too many, if that makes sense. It's the standard process of staff absence. I don't think it's more critical since the COVID-19 situations come through. But one thing I have noticed is how many people are stepping forward to do extra shifts, and how many people are so willing to work an extra day or an extra half day, just to make sure that their colleagues are well covered. And I can't thank people enough for that. That's been amazing.
Thank you very much.
Yeah, I mean, can I echo that across the whole of health and social care? The number of people who've stepped forward and said they'll work that little bit extra, or in some cases a lot extra, to try and help their colleagues out. People really are going the extra mile all over the department, and, you know, they're making a real difference. And it's phenomenal. It really is. The way I've seen everyone across the whole department pulled together, and the wider community as well, with people stepping up, offers of help to do this or that. We should be exceptionally proud of the way the Isle of Man has reacted to this, because as a community we have pulled together, and we are working together to fight this disease. Well, Paul is waving at me. Has you got a question?
Sorry, I thought there was more people to wait. Just to confer that, and conclude with you that the Chief Minister's come back tomorrow. Lawrence Skelly said that Tuesday's the big day for the announcement, and everyone's waiting for that. Is that right?
The Chief Minister is back with you tomorrow, Paul. I know he's missed you enormously over the last 2 weeks, and he will be back with you tomorrow, safe and sound. Well, can I thank Liz for coming along today, for doing this with me. Thank you very much for your input, Liz. It's very much appreciated, and I know the press have appreciated it as well. Rounding off, I have 2 shout-outs to do. The first shout-out is for Bob Corkish, a 95-year-old resident at Southlands, our residential home in Port Erin. Bob is doing his own Captain Tom Moore effort and is walking laps of the courtyard there. This has been organised by him and his daughter Angie Eyre, who's well known for her fundraising and campaign work for breast cancer research. I believe that he's raised £6,000 already. Bob wants the money to go to the Friends of Nobles Hospital. He is being supported by staff at Southlands in the challenge, and I'm sure he's heading to be his own media star on Ireland soon. So thank you, Bob, for this tremendous effort. Also, I want to end with a very special shout out. I saw a news story the other day about a lady who is celebrating her birthday, but in self-isolation. Not unusual, you may say. Many of us have celebrated birthdays at home or in self-isolation. But this is a birthday with a difference, as this lady's turning 100. So a massive heartfelt shout out to Kathleen Jenkins on her amazing milestone of reaching 100. I just wish you could have been celebrating in different circumstances. But a very, very happy birthday. And I'm sure all of us across our Ireland community want to celebrate the fact that you've reached that absolutely wonderful milestone. So happy birthday from me. So thank you very much, everyone. As I said, the Chief Minister will be back with you tomorrow. I know he's missed you all very much. Thank you very much.